As a nation, we spend more money on healthcare than anybody else in the world, and we by no means have the best outcomes. And that's true at every level of our society. But we're also seeing a dramatic increase in chronic diseases, obesity, diabetes, hypertension, diseases that you can't cure with medicine. So how are we going to adjust to that? I mean, the nature of our challenges has changed, and in many ways we're still somewhat trapped in our own model, right? And the research tells us really where we need to go.
Some Iowans will die 20 years earlier than others who live just a short distance away because of differences in social and environmental determinants, such as education, income, race, ethnicity, and where they live. These Iowans die from preventable health problems, and their health is greatly influenced by these powerful social determinants. We must find ways to reverse the negative effects of these factors and enable more people to lead healthy lives and avoid getting sick in the first place. Social determinants of health are conditions under which people live and work that influence health and quality of life. They are societal risk conditions, rather than individual risk factors that either increase or decrease the risk of disease, such as type 2 diabetes. Another way to think about the social determinants of health is they are the conditions that are beyond the ability of an individual to impact on their own.
We develop a series of activities that will help us to engage our staff, to address these changes, and be more proactive about how we can serve better our community. The first one was to conduct research of health data. We want to know, what is the numbers, how in the area of social determinants, how factors as employment, housing, poverty level, children in poverty, even use of food stamps, factors like that affect our community. We notice that some zip codes are really struggling in comparison with the rest. So we want to know what's happening there.
We know where people live is one of the most important determinants of health. For example, here in Polk County, there are 6 zip code regions that rank among the top 10 in a number of negative indicators. Unemployment, vacant housing, below poverty, children below poverty, food stamps, housing burden renters, housing burden owners. In September 2015, Tyler Norris facilitated a staff retreat and planning session on social and environmental determinants of health.
So our conversation has been about what creates health. What are the drivers of health, the determinants of health, the contributors to health, and what undercuts people's ability to be healthy or to manage their chronic conditions. And we started off with a beginning of perhaps only 10% of what creates health has to do with access to medical care services. Another 30% has to do with our biological inheritance or our genetics. But fully 60% of what creates health has to do with our lifestyle and behaviors in the context of our environment. So what we eat, how much we move, our use of tobacco or our immoderate use of alcohol or other drugs, and how that's influenced by the socioeconomic and environmental factors in the community that either support healthier lifestyles or sort of challenge us having healthier lifestyles. Here in Polk County, how does access to healthy, affordable, fresh food, because people have the ability to actually physically get to a place or be able to afford that food. How is that impacting health or supporting somebody's ability to manage their diabetes or hypertension? The sense that their housing is adequate to not have the dust and the mold that might drive asthma. The way in which the neighborhood is safe enough, both has sidewalks and crossing and adequate lighting that parents would feel comfortable with their kids being physically active, walking to school, et cetera, walking to work. How much does the environment actually support physical activity so that we make sure we get our 30 minutes a day or 60 minutes a day for kids? And how much does the culture that we live in essentially support healthier lifestyles?
In addition of that, we conduct also a series of testimonials. We ask for community leaders, patients to share, their experience with these factors, with social determinants. So as you will see in this video, some of these comments, provide a good information, a good input about how, how these numbers translate in actually real life and real impact that these determinants have over the life of these people.